Jade. I'm going to be your student nurse today. And I would tell mom. This baby doesn't understand, obviously. I'm going to do my hand hygiene. I'm going to check the infant's band. I'm going to, let's see. I'm going to do their pulse for a full minute. Respers for a full minute. Take the temperature. Okay. Then after that, I'm going to listen to heart sounds. Lung sounds as well. And bowel sounds while I'm here. In all 4 quadrants. Okay. I'm going to listen to the breathing on the backside. And then while I'm on the back, I'm going to check the contour of the spine. Note any dimples in the back. And just assess the skin on the backside. I'm going to go ahead and just assess the skin in general. We're going to note the color, any bruising or birthmarks, rashes, jaundice. I'm going to check the skin turgor. While we're looking here, we're going to check for the 5 signs of respiratory distress, grunting, the apnea, nasal flaring, yeah, I don't remember those. So then I'm going to palpate the abdomen, assess like that it's round, normal. Okay. I'm going to put this back on to keep baby warm during consistent. We're going to look at the head, molding, suture lines, the fontanelles. I'm going to palpate the neck, check for masses, make sure the clavicles are intact. Also with the neck, the range of motion. I'm going to look at the eyes, see if there's any drainage or anything coming out of the eyes. They're bilateral. The epicanthal folds, we're going to assess that. And then with the ears, we're going to make sure they're symmetrical and assess the cartilage recoil, both sides. The nose, we're going to just check the patency of the nares, make sure they're breathing. And for the mouth, I'm going to put gloves on. And I'm going to ask mom, like, when the last time baby was fed or when the next time they're going to be fed. I'm going to assess their suck reflex, or not reflex, but just how they suck. Their palate, look at that for closure of the palate. Yeah. Okay, I listened to that. We're going to check like musculoskeletal stuff, so like their arm, resist, recoil stuff. I'm going to check their palmar creases and their plantar creases. We're going to count 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5. Okay. Now I'm going to check the genitalia. Before that, actually, I'm going to assess the umbilical cord, dryness, how it's healing, if there's bleeding, anything. And then the genitalia for the female, I'm going to assess the labia, make sure Checking any drainage, discharge, not drainage, discharge. And then for the male, I'm going to assess the scrotum and the rugae on the scrotum, and if the testes have descended, and also the placement, or like where the urinary meatus is, so where that's at. Said we're gonna ask mom when last time they had bowel movement, repeat. In general, we're just gonna like assess how the baby did during the assessment, then more reflex, Babinski reflex on the foot. Let's see. I think that's all. I think that's everything. Okay. Awesome. Okay, well, thank you. That is all.